I'm Dr. Katherine Harris, and today we're going to talk about something a lot of people are curious about, but very few people are taught well: anal sex. More specifically, the rule number one of anal sex that almost no one follows, and yes, that's exactly why it hurts for so many. If you've ever wondered why some people report pain, burning, or a feeling of hitting a wall, you're about to understand the anatomy, the mindset, and the technique that flips that experience from fear to comfort. This is not about graphic detail or shock value, it's about clarity, consent, and care. My goal today is to give you evidence-based, judgment-free education so you can make informed decisions for your body and your relationships. As always, this video is for general information. It's not a substitute for care from your own clinician. Let's start with the big idea, the headline you came for. The number one rule of anal sex is very simple to say and surprisingly hard for people to follow in practice. Slow, relaxed, and generously lubricated, never push past pain. That's it. No rushing, no going from 0 to full penetration, no forcing, and absolutely no, it'll feel better if we just get it over with. The anal sphincter is a ring of muscles designed to hold things in, not to welcome them in quickly. Those muscles protect you. When they feel rushed or threatened, they tighten reflexively, and that's when pain shows up. When people ignore that basic protective reflex and try to push through, they create the very discomfort they're trying to avoid. Respect the sphincter, go slow, use more lube than you think you need, and stop at pain, not because you're fragile, but because your body is wise. If you remember nothing else from this video, keep that sentence: slow, relaxed, lubricated, never past pain. In my practice, I call it the 4 corners of comfort, and every other tip today is just a practical way to help you live those 4 corners moment by moment. We're going to talk anatomy, breathing, communication, prep, positions, hygiene myths and realities, lubes and condoms, common mistakes, red flags, aftercare, and how to tell the difference between okay for now discomfort and stop right now pain. Whether you're a beginner, someone returning after a bad experience, or simply interested in understanding bodies better, this will give you a roadmap that's calm, respectful, and doable. First, a quick anatomy tour in plain language. You have 2 anal sphincters. The external one you can partially control, and the internal one you can't control consciously. Think of them as a set of doors that like to open outward to let things out. Asking them to open inward is possible, but only with patience and a sense of safety. Inside the anal canal, the tissue is delicate and not self-lubricating. That means friction is your enemy unless you provide lubrication from the outside. A little deeper inside is the rectum, which can be more accommodating, but if the outer ring isn't relaxed, you won't get there comfortably. This is why many people describe that tight ring feeling. They're meeting a muscle doing its job. Your job is not to fight it, it's to invite it to soften. Now, what creates that sense of safety so the sphincter can relax? Your nervous system. If your mind is tense, embarrassed, or pressured, your body will mirror that. If you feel rushed, judged, or worried about mess or performance, your sphincter will brace. We cannot separate anatomy from emotions here. The pelvic floor listens to your thoughts. Which brings us to the first practical step: mindset and communication. If you can't talk about it, your body probably isn't ready to do it. That doesn't mean a performance review or a stiff script. It means gentle, explicit agreements about pacing, signals, and boundaries. Decide on a safe word or a simple scale from 1 to 10, where anything above a 3 is a pause. Agree that stop means stop immediately, no questions asked, and pause means we ease back and breathe. Clarify that nobody gets to feel guilty for asking to slow down. The most attractive thing in the room is mutual care. Let's turn to lubrication, the unsung hero. The anal canal does not lubricate itself. If you think you've used enough lube, double it. Water-based lubricants are condom-friendly and easy to clean. They can dry out faster, so reapply often. Silicone-based lubricants last longer and tend to be very glidey. They're also condom-friendly, but can degrade some silicone toys, so check your product. Oil-based products can break down latex condoms and are harder to clean, so they are best avoided with latex and with many toys. For long sessions, many people prefer a base layer of silicone lube and touch-ups with water-based lube, but the brand matters less than the habit. Apply before, reapply during, and don't be stingy. Pain very often is just friction plus tension. Lube solves friction. Breath and pacing solve tension. Before any penetration, think in terms of gradual invitations. The first invitation is simple touch. External massage around the perineum and the outer ring can be surprisingly effective for signaling safety to the sphincter. The second invitation is a well-lubricated fingertip, nail-trimmed and smooth, with a glove if you want easier glide. The fingertip can wait at the entrance and follow the breath. On the inhale, nothing changes. On the exhale, when the pelvic floor naturally relaxes, the fingertip can apply the smallest pressure. If the body says no, you wait. If the body softens, you proceed a little, then stop and let the tissue acclimate. That pause is not wasted time. It's the moment your nervous system updates from unknown to okay. Count to 10. Breathe. Check in. Add more lube. If you skip that pause, you're skipping the permission your body needs. Some people benefit from gentle, progressive training with anal dilators or appropriately sized, body-safe toys. The point isn't to stretch out permanently. Your body is elastic and responsive. It's to build trust with your own muscles. You start small, never jump sizes, and treat each session like practice in listening. The sign you're ready to level up is not, I tolerated it. It's, my body relaxed and the sensation moved from sharp to full and pressure-like. Sharp, stinging, or burning is a no. Dull pressure that eases with breath is a maybe keep going. Fullness that feels manageable and eventually pleasurable is the yes you're waiting for. The difference is night and day once you learn the signals. Let's talk about breath, because it's your remote control for the pelvic floor. When you inhale, your diaphragm descends and the pelvic floor reflexively releases. When you exhale, you can imagine the ring softening like a camera aperture opening. Try this. Inhale through your nose, let your belly gently expand. Exhale through your mouth like you're fogging a mirror, and think the word soften. This isn't fluffy advice, it's physiology. Pair that breath with stillness during initial entry. Movement can resume once the ring says yes, not before. If your partner is involved, they can breathe with you and match your pace. If they can't match your breath, they can't match your body. That's a great rule of thumb. Positions matter. In general, positions that give the receiver direct control over depth and angle tend to be more comfortable at the beginning. If you're solo, 1 or 2 fingers with plenty of lube while lying on your side with your top knee bent can be gentle and controlled. With a partner, positions where the receiver can guide the angle, such as on top or lying on the side, often create less pressure on the sphincter. Straight on, forceful angles are more likely to hit the ring like a doorstop. Think of entry like threading a needle. You angle and align before you move forward. Tiny changes in angle make a big difference in sensation. Now, a word about hygiene and the fear that keeps many people tense. The truth, the lower rectum can be clean enough for gentle play with a little planning. A light rinse with warm water using a bulb designed for the rectum can be sufficient for many. Too much flushing, high pressure, or harsh solutions can irritate tissue and actually increase the risk of discomfort or micro tears. If you choose to rinse, do it gently and give yourself time to expel water fully. Avoid soap inside the rectum. For many people, a simple pre-play bathroom visit, a warm shower, and a quick wipe are plenty. Diet can influence comfort. Very heavy, greasy meals right before play may not feel great. But you don't need a perfect routine to have a comfortable experience. The key is realistic expectations and kindness toward your body. Let's address condoms and barriers. Condoms are strongly recommended for anal sex because the rectal mucosa is delicate, and condoms reduce risk of infections. Use a new condom if switching between anal and other activities to protect everyone's health and to reduce the risk of bacterial transfer. Pair condoms with plenty of lube applied both inside the condom and outside. Remember, oil and latex are not friends. Stick with water-based or silicone-based lubes with latex. If toys are involved, think one toy, one orifice, one condom, unless you're cleaning and changing in between. What about the difference between discomfort and pain? Discomfort at the beginning often feels like pressure, fullness, or a stretch that decreases as you breathe and wait. Pain feels sharp, hot, stinging, or like your body is recoiling. Pain is a stop sign, not a challenge. Continuing in pain is what leads to tiny tears, bleeding, and longer recovery. If you notice bright red blood, persistent pain, or a tearing sensation, stop, apply gentle care, and give your body a rest. A thin layer of a plain, fragrance-free barrier cream around the outside can support comfort while you heal. If pain persists, bleeding continues, or you have a history of fissures or hemorrhoids, consult a clinician for a personalized plan. A quick but important sidebar: sometimes people think anal sex should hurt at first, and that's normal. No, new sensations can be intense, yes, but true pain, especially sharp, burning pain, is your body saying, slow down or stop. Expecting pain and pushing through it teaches your sphincter to brace harder next time. Expecting ease and taking the steps to create it teaches your sphincter that it's safe to release. The lesson your body learns tonight is the experience you have tomorrow, so choose a lesson worth repeating. Let's bring this back to our number one rule and break it into very practical micro steps you can remember under pressure. First, talk, set pace, signals, and the right to stop. Second, prep. Empty your bowels if you need, rinse gently if you prefer, trim nails, gather lube and protection. Third, warm up. External touch, breath, and the first fingertip on the exhale with more lube than you think is necessary. Fourth, pause. Wait for the ring to soften and the sharpness to turn to fullness. Fifth, progress. Small, still entry, then shallow, slow motion, relubricate, and check in. Sixth, protect. Use condoms, change if switching activities, and keep toys clean. Seventh, reflect. If anything stings or burns, stop, reassess angle, add lube, breathe, or try again another day. This is care, not a test. Common mistakes? Rushing is number 1. Not enough lube is number 2. Skipping warm-up is number 3. Going for maximum size or speed too soon is number 4. Ignoring your partner's words, or the lack of them, is number 5. And number 6, which almost no one admits, pride. The belief that you should already know how is the trap. You wouldn't fault yourself for learning to dance slowly, step by step, and your body deserves the same grace here. Confidence comes from comfort. Comfort comes from cooperation with your own anatomy. Let's talk about pressure from partners, because this is a very real source of pain. If someone gets annoyed when you say slower or not tonight, that's not a mismatch of libido. That's a mismatch of values. The erotic is generous. Coercion is not. The sex you'll remember warmly is the sex where someone treated your no, not yet, or less as sacred. If you're the more eager partner, your role isn't to persuade. It's to create an environment where your partner's body says yes on its own. If the body doesn't say yes, take that as a win for trust and try another time. If you've had a painful experience before, you're not broken. Your muscles learned a protective pattern. You can teach them a new one. Start with breath practice without any penetration at all. Lie on your side, one hand on your abdomen, one on your chest. Inhale for a count of 4, exhale for a count of 6, and imagine the ring softening on each exhale. Do that for 2 minutes a day. That alone can change the tone of the pelvic floor over time. When you're ready, use a fingertip with lube and practice entry on the exhale with no goal beyond soften and stop. If that's as far as you go that day, that's success. Each gentle rep is a vote for comfort. What about medical conditions? If you have active hemorrhoids, a fissure, rectal bleeding, inflammatory bowel disease flares, infections, or recent surgery, this is not the time for anal play. Healing comes first. If you've been told you have pelvic floor hypertonicity, over-tight pelvic muscles, working with a pelvic floor physical therapist can be transformative. They can teach you reverse Kegels, use biofeedback, and help you map your own sensations so you can distinguish safe stretch from harmful strain. Pelvic health care is not just for postpartum or athletes, it's for anyone with a pelvis. Let's address a few myths quickly. Myth 1. Only beginners need lube. False. Everyone's tissue benefits from Glide. Myth 2. It only hurts the first time. False. It hurts whenever you ignore the basics, whether it's the first time or the 100th. Myth 3. Bigger is always better. False. Better is what your body can welcome today. Myth 4. Clean means clinical. False. Clean enough and comfortable beats overwashing and irritated tissue. Myth 5. If you're tense, it means you don't really want it. False. Tension can mean you want it but need time, breath, and reassurance. Desire and readiness aren't identical. The bridge between them is pacing. We also need to talk about aftercare, the quiet part of a good experience. Aftercare is anything that brings the nervous system back to rest and tells your body you're safe and appreciated. That might be a warm shower, a cuddle, a snack, a glass of water, or simply lying together and breathing. Check for any soreness. A small amount of mild soreness can be normal if you are new to the sensation, but sharp pain, persistent bleeding, or fever are not. Respect the signs your body gives you. Tomorrow, evaluate gently. Did breath help? Did a certain angle feel better? Did you reapply lube often enough? Learning is the most intimate thing you can do together. When people ask me, what's the single most important change that turns anal sex from painful to pleasurable? I always come back to the same answer. It's not a product. It's not a trick. It's a posture of cooperation between partners and with your own body. That cooperation looks like starting smaller than your ego prefers, going slower than your impatience wants, and stopping sooner than your pride would like. It looks like praising yourself for pausing. It looks like being the person who says, let's take a breath, and meaning it. It looks like remembering that pleasure grows where safety lives. Let me give you a simple script you can use because words matter. Before you begin, say, let's go very slowly. I want to stop at the first sign of pain and wait until my body softens. If I say pause or stop, I need you to freeze. If I ask for more lube, let's add more. If it doesn't feel right tonight, we'll try another time. During, say, a little slower, exhale, okay, wait there. More lube, please. That angle was better. Keep it shallow. After, say, thank you for going slow with me. I felt safe. Here's what worked for me. These are not demands. They're care instructions for a precious body, yours. If you're listening today as the partner who initiates, here's your checklist to earn gold stars without being asked. 1. Bring lube and use it generously. 2. Ask before every change. More? Less? Different angle? 3. Match your movements to their breath. 4. Praise pauses. 5. Never, ever take stop personally. If you can do those 5 things consistently, you will be the person whose partners feel safe exploring with, because you've shown them that their comfort governs the pace. Finally, I want to speak to anyone who feels shame for wanting to learn this. There is nothing immature about learning how your body works. There is nothing dirty about caring for delicate tissue. There is nothing silly about saying, I want this to be comfortable or not at all. That is grown-up, self-respecting sexuality. The people who make you feel small for asking questions are usually the ones who never learn to ask their own. Your curiosity is a gift to you and to any partner lucky enough to be with you. So, let's close with exactly what we opened with, because repetition helps the body remember. The number one rule of anal sex, the rule almost no one follows, and the reason so many report pain, is this: slow, relaxed, and generously lubricated, never push past pain. Honor that rule, and everything else becomes easier. Ignore it, and nothing else can compensate. Your body is whispering the instructions already. I'm just translating them into words. If this helped you, keep the conversation going with yourself, with your partner, or with your clinician if you need personalized guidance. Your comfort is not negotiable, and your pace is the right pace. I'm Dr. Catherine Harris, and I'm proud of you for learning something that many adults were never taught. Take a breath, take your time, and take good care of your body.